I love nursing. When I was 5 years old, my mother said to me, you have to be something when you grow up. And I said, I'm going to be a nurse when I grow up. So it was such an easy decision, I see.
Conscious caring. These nurses really want to become better at what they do because they really care about their clients.
You get to give and receive, and it's wonderful to be a nurse and to be able to nurture people.
I started here and realized that I should have done this from the beginning. So at this point, I can't imagine being anything other than a registered nurse and continuing with my career.
My name is Odalis Marte. I grew up here in Jersey City. I really like it here. My family's here. That's great too. You know, growing up here wasn't always easy. We lived in a small apartment. Our neighborhood was changing. But this is my home. I love it. I've always wanted to find my way into a career that would let me give back, do what I can for the people that live and work around here, my family. This is my sister, Rosa. She's 2 years older than me, and she's a nurse. And you know, she's really happy doing what she does. She works around all kinds of people, and she really gets to make a difference in their lives. Watching my sister giving like 150% to her job and feeling so good about it made me realize that I guess I've always wanted a career where I can get that. And nursing, I think, is the way for me to do it.
A nurse, to me, is a nurturer and is a scientist. You have to have the knowledge based on evidence to provide care, but you also have to have a connection because it's an interpersonal relationship.
It's very rewarding to see someone come in severely injured, critically ill, or even come in for a simple surgery and know that they're going to walk out because you took every step and every, motion that you had to do to make sure that they came out better than when they came in, or at a state where they can go back to their normal lives.
One of the challenges that we face, particularly here in Hudson County, is that we have a very high Hispanic and Latino population living here, and the nurses taking care of them are not necessarily Hispanic and Latino nurses.
Hospitals in particular have a need for bilingual staff. It's a patient safety issue. It's sometimes the only means that we have of communicating with patients in real time without using some type of technology where the translator isn't present in the room with you.
There's that initial gap that is bridged immediately once you have a Hispanic nurse dealing with a Hispanic patient. There's that rapport, that trust, that understanding, that conversation that doesn't need to be had because there's that communication that sets that trend.
Because if these nurses are going to render care to patients in a compassionate way, it's extremely important for them as well to have an understanding of the cultural needs of that individual. And the more varied the individuals are who come into our profession, the better it's going to be for the patients that we serve.
They'll be more free to speak about what is their health problem, and that's why we really need more Hispanic Latino nurses in the community, in the hospitals, and in the public health arena as well.
A large number of these individuals are pursuing a 2-year or community college degree in nursing. Upon completion, they are seeking to continue their education in a 4-year baccalaureate program.
Because we know that that's a standard that we go on for a bachelor's degree. We tell students that all the time, that the associate's degree is really just the stepping stone. And yet at the same time, it can be very challenging to find a program for a BSN completion that honors the work that you've already done.